It's time for another episode of Hormones, Metabolism, and You. Thank you so much for joining me this week. I'm your host, Dr. Cassie Smith. I am a dual board certified endocrinologist and internal medicine doctor who is now practicing functional medicine out of Oklahoma City. Although we do have licenses in over 42 states, so we can see you virtually from almost any state in the United States. Today, I'm super excited to introduce you guys to Dustin Pollard and Lacy Long. They are my newest nurse practitioners. Both of them kind of came to me in very interesting ways, but Summer and I were needing some help, and I found two amazing people. I think it's very important for you to know the people who are taking care of you. I want you to know their story. I want you to know their why, and I want you to know what they like about their job and how they got to Modern Endocrine. So I just asked them some very basic questions about what they do and how they got here, what they like to do, what sort of patients they like to see, funny and interesting things about them. And we even do some fun stuff at the end, just like rapid fire questions. I also tell you towards the end of the interviews with each of them what I appreciate about them and the compliments I get about them from patients. So again, I just like people to really feel comfortable at Modern Endocrine and know the people who are helping take care of you, because we really appreciate you. Today, I am interviewing one of Modern Endocrine's newest members of our cult team. This is Lacy Long. So she is a nurse practitioner, and she joined us about a month ago. She just finished school. I'm going to let her kind of tell you a little bit about her backstory, but I wanted you guys to be able to get to know her and get to know Summer and Dustin, one of our newest member after Lacy. And so we're going to talk about lots of things today. Just what is it like to work at Modern Endocrine? What have you learned? What are things that Lacy's excited about? What is she going to focus on? And just let you guys kind of learn a little bit about her. So thanks for joining me, Lacy.
Yeah, happy to be here.
Okay, so I think let's start with just like tell people, what do you do at Modern Endocrine, or how did you get here? Let's talk about like how did you become a nurse practitioner? So obviously with nurse practitioners, you start as a nurse. For people listening who don't understand, you start as a nurse when you're a nurse practitioner. And so what kind of got you into medicine, and then what led you into becoming a nurse and nurse practitioner? Kind of tell everyone your story.
My nursing career started in women's health. So I started as a labor nurse and doing that for a few years until I got offered a position as a school nurse in a small town. And so I did that. I had young kids at the time, so it made a lot of sense with our schedules and things like that. And I did it for that reason, but that kind of turned into like a love for community health and being in the community and helping people outside of like the hospital setting. And I just saw so many issues. Like I talked to so many families and so many kids and all these kinds of things, and you just see like this huge gap in healthcare. And so that kind of led me into going back to school, which is something I told myself I would never do, but I did, and I'm glad I did. But through that process, kind of seeing the conventional medicine layout, I guess, it made me realize that I really didn't want to do that. I didn't want to be in a typical like primary care office and things like that, which kind of led me into the functional medicine pathway. So now here we are.
So you started out as a nurse, then you were a school nurse, and then your desire to help other people led you here. And so you were doing your rotations, the end of your rotations earlier this year, and you came to our clinic, and then we sort of kind of derailed your plans of maybe working in primary care. Sorry, not sorry, but now you're with us. Yeah. Okay. So love that story. Love that you were a school nurse. That's hard. Where do you want to tell people, like, where'd you grow up? I think that's interesting too. Did you grow up in Oklahoma? Did you grow up in New York City? Where'd you grow up?
I grew up in a small town in Oklahoma. It's called Stroud. Most people don't know where that's at. There's like maybe 2,000 people there. And we still live close to there. We live in a town a little bit bigger than that, but we still live close by. So we're small town people.
Stroud, Oklahoma is where the chicken place is, right? Did I make that up? No, that's Okarche.
Yeah, that's Okarche.
Okay, never mind. Ignore me.
Similar.
Okay. I just know our patients talk about the chicken place, but I thought it was Stroud, but it's not. Okay, so you grew up in a small town, and you've been working at Modern Endocrine for about a month now. Yeah, it's been about a month. So how would you describe Modern Endocrine to somebody you just met? Like if somebody said, "What do you do?" What would you say?
That's a complicated question. because it's endocrinology. It is, but endocrinology is kind of intertwined with everything. And so whenever people come here, they're not just getting just like one aspect of their health dealt with. They kind of get everything at one time. So I feel like when people ask like what we do here, it kind of leads into like a long conversation because you can't really say it quickly because everything from like inflammation to hormones to, I mean, even like heart health and things like that are all things that we address. So I mean, everything kind of plays in together. So it's more holistic, I guess. It's more of a holistic practice.
Yeah, I like that. I think that Modern Endocrine is like a good place where you come and just get all your healthcare needs met wherever you are at that point. Like if you're healthy and you want to focus on longevity, we do that. If you're not healthy and we need to focus on some things to get you healthy, we do that. And if you feel like, you've seen 20 doctors and you're a complete mess and you don't even know where to begin, we specialize in that, right?
Yeah.
That's what we do.
I feel like we do a good job at kind of like talking to the patient, seeing what their goals are. Like, because everyone kind of has different, expectations and things that they want to accomplish and what they expect to be good in life. And so it's nice. Like here, it's like you just talk to the patient, see what they're wanting to accomplish, and then seeing what you can do to help them get there. So that's kind of nice.
Yes. And the nice thing is we don't have these constraints with like insurance companies and things like that dictating how we care for patients and how long we spend with patients, which is what I love. That's the best part, right? And the second thing that I love is that people actually get better, which is nice too, right?
Yes. Outcomes are great.
So you've been here for a month. So have you seen that? I guess that's my question is like, do you feel like it's different than the other rotations you did? Do you feel like people actually get better, get the care that they need? Like what have you observed with that?
Yeah, so let's see. My rotations here started in April, I think, and now it's the end of June. And so now like we've seen like some of the newer patients that were back in April, like we've seen the follow-ups now of those patients, and yeah, they're completely different. Like they came in like emotional and upset and didn't know where to turn to, and now they come back and there's like life in their face and they're happy and smiling and feeling a lot better. And yeah, you see a huge difference. So
yeah, I think you told me, I think it was last week, we saw somebody who we'd seen in April, right? And although we came out of the room and you're like, she still has a lot going on, she's a lot better, right? Like you even said, she's totally different than she was in April. And so I think that's really powerful and fun to see and for you to see in a short amount of time. And so I'm lucky enough to see that all the time, which is why we do what we do. And although sometimes, it can feel overwhelming. Like I tell people this all the time, that the word I think I hear from patients the most, and you could, let me know what you think, is a lot of people come to us and they are just very overwhelmed. Like if I have to pick one word, it's overwhelmed, that you hear like over and over and over, like overwhelmed with how sick they are or how much they've done or where to start or how to get better. And so they just don't do anything, right? Because it's human nature when you're overwhelmed and everything's hard to just not do anything. And so we hear that a lot with patients. But then a lot of times, like when I was talking to you about starting and I was talking to Summer, because Summer's been with us for a year, Summer's like, sometimes as a provider, it's overwhelming too, because it's like you're drinking from a fire hose. And so I think that's important, to know as well. Like, although patients feel overwhelmed, I think we have a really good environment you can come to, and we try to make you feel very welcome, because we all know what that feels like. I know what it felt like whenever I got out of school and tried to learn all this. And I think you used that word a couple weeks ago after you went to hormone training, right? Where it's like, oh, I feel like I'm drinking from a fire hose, but it's a good thing, right? Like you're just learning all these different ways to help people.
I would agree with all of that.
So we understand what overwhelm feels like from a different perspective. But the cool thing is like, I tell patients this all the time. We kind of specialize in that, right? Like, even though people feel like when we do lab reviews, they get 10 or 12 diagnoses and they're like, oh my gosh, am I the worst person you've ever seen? The answer is always no. And it's like, I've seen 5 of you today, actually. So don't feel bad, right?
Yeah.
So what do you think, like, what have you learned so far by working at Modern Endocrine? Like, what are some things that stick out?
I think just mainly the difference between just treating illness and then just getting people to like an optimal level of health. It's probably the biggest difference that I've seen. Like, it's not just like, we're going to give you some medication and we're going to try to push you into like this normal range of your labs and tell you you're fine and move on. It's like talking to people about how they feel and like optimizing not just like medications, but maybe their supplements or maybe their lifestyle, maybe their diet, maybe whatever it is, just like talking to them and seeing what may be off and helping them get their life to like an optimal level to where they're actually, you know, enjoying life and living life the way they should and being, I don't know, living their life at a higher level. I think that's might be the better way of putting it.
Yeah. And I think that makes me very happy to hear you say that, because I think, I don't know that I emphasized this to you very much when you started, but I do to the staff. And I try to, like, how people feel really matters. And that's something they don't teach you in school. And then actually in school, what they teach you is how people feel doesn't matter. They teach you, like, you put them in the box, you give them their prescription, and you kick them out the door. Especially in medicine, that's what they teach you. And especially in the hospital, right? It's like, oh, okay, you fit in a box, everything looks fine, goodbye. And I think how people feel is very important and very validating. And you have to use that in addition to all the information you have from labs in order to make someone, you know, healthy and feel the best. And so that's why every single patient we see at Modern Endocrine, our staff know the first thing you ask them is, how are you feeling? And so in all of our notes, when we go into rooms, it says patient is feeling tired, great, wonderful, sad, angry, anxious. Like, we want to know how you feel because that helps us figure out how to make you feel better, right?
Right. Yep. So, yeah, like we're taught how to kind of put everyone into a guideline. And functional medicine can be difficult sometimes because there's not guidelines. There's not very many guidelines to go off of for functional medicine specifically. But that's kind of nice sometimes too, because you can adjust things as you need to and try different things.
Yeah, and that brings up a good point. So my friend McCall just texted me yesterday. She's kind of finishing up her book about thyroid health. And she said, you know, Cassie, will you tell me what you learned in med school and in fellowship about thyroid? Because she's a PA and she's like, I learned nothing. You know, I learned everything that's actually not correct. And I think that's a very valid point, is like, you know, what did you learn in school as a nurse practitioner just recently? What did you learn about thyroid hormone? What did you learn about thyroid? What did you learn about hormones? What did you learn about gut health and nutrition and just functional medicine in general? Did you learn anything?
Very, very little. Like when it comes to thyroid specifically, it was very much just like checking TSH, maybe T4. And that was, I mean, they went over it. And it may have been like maybe a very quick lecture, and that was about it. And then like when you're studying for boards and things like that, it's very simple. Like I didn't know all of even like the medication options that we even had for thyroid until I came here. And like, because they don't teach all the specifics when it comes to thyroid specifically. When it comes to nutrition, there wasn't much. I will say that we didn't have like a nutrition class or anything like that. We may have had a lecture. or something.
Zero nutrition in med school too, y'all. So
like it was very minimal. In functional medicine, no.
Yeah.
It was all conventional.
Which is really sad, because I've been out of school for about 10 years now, right? And I did a fellowship, but like we haven't changed, and we're not getting any better. And like, we know gut health is so important to your overall health, and we're not teaching anyone, providers, nurse practitioners, PAs, doctors, anyone, how to actually fix people and talk to them about nutrition. So
they're big on like patient-centered care, which is interesting because they're like it's always a shared decision making. It's, you know, always listen to the patient, see what they're wanting, all this kind of stuff. But like, and that's great, but it doesn't line up with like, then what? You know, like you talk to the patient, you get all this information, but then it doesn't fit into the guidelines that we're given. And so it's just interesting, sad, and hopefully going to be fixed. But so here's my next question. What are you most excited about learning at Modern Endocrine, and where do you think you're going to end up like really wanting to learn and focus on from a patient perspective? Like, not saying that these are the only type of patients you're going to see, but what really like interests you that we've done so far and makes you think like, whoa, I want to learn a ton more about that, because that really helps people. I think the gut health stuff, I think there's a lot of interesting like developments and stuff happening there. I can't even remember the statistic now, but it was like, I heard something like how many like just specifically gut health studies that are being produced like every month right now is like outrageous. And so they're like learning all this new information about it. And we do gut mapping at the clinic, and it's very interesting to see how people improve and all that kind of stuff after they go through the whole protocol. And so I do like that quite a bit. And I have a passion for kids just because like that's what I know. I know a lot of stuff with kids, but I also like through school nursing, like it's not really like so much as treating the kids as it is treating the parents and educating the adults that have the kids at home. And so just like really focusing in on like education for like nutrition and exercise and using peptides or whatever it is to optimize like the parents' health so they can bring that into their house for their whole family. I really like that.
Yeah, I think that's so powerful. I think family units are becoming like a dying thing in our culture, especially like extended family units. And I think what people forget is your kids see everything that you do and they hear everything that you do. And so if you as a parent are healthy and you're making good choices and you're walking and you're sleeping, your kids are going to see that. And I think that's really, really important for where we're going in the trajectory of healthcare. And to your point, really helping parents figure out what they can do to make their kids healthier. Because unfortunately, our country, our food industry, our like social media, the TV ads are destroying children. Like they are targeting kids at younger and younger ages. They're putting all these terrible dyes and fillers in their foods, which change their, their mood and their ability to have attention in school. We have all these kids with ADHD and autism, and it's just insane. And I think a lot of parents feel overwhelmed and they have no idea what to do, right? And so all these kids get put on medications that they shouldn't be on. And really, you just need to go back to educating parents about sleep and nutrition and not being on screens all the time and things like that. So I think that is really powerful, and I'm excited that you want to learn about that sort of thing. I told you this before we started, but we're about to take a big master class on gut health in kids and adolescents, and also ADHD and behavior issues in kids and how you fix that holistically. So I'm excited for us to go on that journey together. And I think it all kind of ties together too, right? Like you said, your gut health is so important for the rest of you, like hormones and thyroid and everything that we do, weight loss, it all ties back to your gut. So if you don't have a good gut, it won't work. If you have mold, I don't care what problem you have. If your gut doesn't work and you can't detox and you don't poop every day and your liver isn't able to clear out toxins, you will not get better and you will not be able to use the hormones your doctor is giving you. So if you have a chronic issue and you haven't gotten better and nobody's talked to you about your gut, nobody knows anything about your gut, you need a different doctor. And I'm hoping in 5 years, people will realize that, right? It'll be totally different.
Hopefully. Yeah.
Maybe in 1 year, it will be totally different. Okay. So what is one interesting thing about you?
Interesting.
Besides the fact that you grew up in Stroud and you were a school nurse, because that's kind of cool.
That's a little interesting.
Like, do you do all the crazy things your husband does? Like all those crazy, like triathlon things or whatever he does?
No, I might be crazy for supporting him in everything he does.
Well, I think it's a little interesting / crazy that you have 2 children that are 11 and 9.
Yeah.
And now you're pregnant again, so you decided to start over. I think that's a little interesting. Yeah. What brought that on? Like that was just like let's go for it one more time, or what? What was
just again? I think it was one of my husband's crazy ideas.
Oh, okay. But we're gonna blame Tanner.
Yeah, we'll just blame him. But he wants a big family, which I do too. Like he started thinking about like later in life, like who's going to take care of us? Like he wants to be surrounded by family and stuff, which is great. And he's like, I don't know that we're going to get that done with 2 kids. And it's like, I don't know either. And so, but I think we're good after this one.
So that's how that happened. What's a fun fact about you then?
Let's see. I used to dance. I was on the dance team at UCO.
You were on
a long time ago.
That is a fun fact. You were on the dance team at UCO. Okay.
A long time ago.
How did you meet? I think this is a fun fact. Did you tell me you met your husband like in school? How did you meet your husband?
Yeah. So that's an interesting story, I guess. We were both working at Walgreens. We did not go to the same college. In the same town, 2 colleges in the same town. But he was going to pharmacy school at the time and was working in the pharmacy. And then I was just like floor girl out front. And I met him because he went out to help stock shelves, and he was stocking tampons of all things. Don't know.
That's amazing. So you met your husband while he was stocking tampons at Walgreens. I think that's an interesting fact.
So that's kind of weird.
Tanner failed to mention that to me when I met him.
Yeah.
I think that's a fun and interesting fact. I have a question for you. If you weren't in medicine, what's your dream job?
I like numbers. Maybe something with numbers, or maybe just, I don't know, something that keeps you active all day, Like,
Personal trainer.
yeah, like something that would be kind of fun.
I agree.
Definitely have to be around people though. I can't just not be around people.
You don't want to be at home with your 3 children all day?
No.
Okay. What is your go-to healthy meal?
Ooh, okay. Let's see. Go to healthy meal. That's hard because I don't cook very often.
Well, let's say somebody else would cook for you. What's your go-to one healthy meal?
I would say like a really good steak and like a big O salad and like eating outside. Like just like a good healthy
Maybe a
meat.
sweet potato. I love a steak and sweet
Sweet
potato
potato would be
salad.
great.
Little
Yes.
rice. Okay. What is one word that describes you best? If you had to pick one word, have you ever done that?
No.
Yeah. One word that describes you best.
Trying to find something more positive than busy because I can make myself real busy all the time.
Yeah, I would say positive. You're definitely very positive, which I like. So that's a good word. You're very positive. If there's one, do you play any instruments?
No, I'm not musically inclined at all.
I'm not either, but if you could play any instrument, what would you play?
I've always wanted to play the fiddle.
Okay. I love it. The fiddle.
Like Devil Went Down to Georgia,
Uh-huh.
I always thought
Okay.
that was cool.
Okay. So she would play the fiddle. What
Yeah.
about if you could talk to anyone, dead or alive, and ask them whatever you wanted, who would you talk to?
Goodness. Like someone
Pick
like
their
I
brain.
knew or someone
No, it
famous?
doesn't matter. Anyone. If you could pick anyone dead or alive and pick their brain, who would you talk to? You don't have like somebody you looked up to that you're like, man, I would love to ask them questions.
Most of the people I look up to are still alive. So,
Then who would you talk to? I said dead or alive.
oh, you did?
Yes.
Okay, dead or alive. Let's see. I know you already got to meet Mark Hyman, but I would love to meet Mark Hyman. I would
Okay.
probably fangirl out if I got to meet him.
Fangirl out.
Or
Dr. Mark
RFK.
Hyman.
RFK would be so fun to talk to too. RFK
Yep.
Jr. Yeah.
Okay. Well, we'll see if we can make that happen.
That'd
Dr.
be
Hyman or RFK. Okay. Pick one. Salty or sweet?
sweet.
Yeah, it depends. Okay. Early bird or night owl?
Definitely early bird.
Summer or winter?
Usually summer.
But right now it's winter because you're pregnant.
Yeah.
In the middle of
So-
summer. You guys, Lacey tried to take a walk the other day. We tried to walk at clinic at lunch, and she's like, what, 7 months pregnant right now, 8 months pregnant, and it's June 26th, so it's like 1,000,000 degrees in Oklahoma. And so we tried to take this little half-mile walk at lunch, like Summer and I and everyone at work. And she went outside to start walking. Did you even make it, or did you come back? But she
I
comes
made
back
it,
in. Did you? She comes back in and she looked like she was gonna pass out, a little confused, kind of white. And I was like, "What's wrong with you?" And she's like, "I just got so hot. I don't know. I might need to lay down." And I'm like, "Well, maybe we shouldn't be walking, but it's 112 outside and we're super pregnant." It was cute, but so maybe she doesn't love summer right now was the point to that, but typically she does. Rain or shine?
Shine.
Walk or run when you're not
Walk.
pregnant? Walk.
Walk.
Okay.
My husband.
Ocean or mountain?
What'd you say?
Ocean or mountains?
Ocean.
Ocean.
Yeah.
I like all those things.
I
Okay.
used to think I wanted to live in the mountains until I went to the mountains, and now I think I'll just stick to the sandy beaches.
It's hard to breathe up there for sure. Hard to breathe. And I don't like to be cold, so I'm not a skier. And I just know too many people that have broken things. So I'm just very like anti-skiing. I'll hike with the best of them, but like, I don't know.
Yeah.
If I'm gonna be in a
like
mountain, I
hiking.
just want to, yeah. If I'm gonna be in a mountain, I just want to sit in a hot tub and like look at things. I don't really want to do a whole lot.
Yeah.
Okay. Did we miss anything? Anything you can think of?
No, I just wish I had something interesting about myself, and I just don't know what that is.
I mean, I'll learn something interesting about you. I'm trying to think. You don't speak another language. You don't play an instrument. I mean, you were a school nurse. That's pretty interesting. You live in a small town. You choose to live in a small town. That's also interesting. And
Halfway
commute to
choose.
work.
I halfway choose to be there.
Halfway choose. It's because your mom lives there, right?
Yeah, because I can't bring my mom with me.
Well, you can. She just doesn't want to come. Yeah?
Right. She can, yes.
Okay.
Bless her.
Well, I want to end by telling you the most common compliment I hear about you from patients so far. So you haven't necessarily been seeing patients a ton on your own, but the compliment I've heard the most about you is she is so cute. She is so cute while she's pregnant. Like people, everyone, like when you leave the room is like, she is so cute pregnant. And I know you don't feel cute pregnant, but you are so cute pregnant. So that's the compliment currently. But I'm sure after you start seeing patients, it will be different. And then I want to tell you the one thing I appreciate the most about you. The thing I appreciate the most about you is since you started, you've just had a wonderful attitude and you are just willing to like learn and help any way possible, which I think is a wonderful asset to have. And I think that we're very lucky to have you at Modern Endocrine. I know patients are going to love you. And so I'm just super happy that we have you and that you've been here helping us and learning.
I'm happy to be here. It's been really exciting.
We're going to miss you when you're gone for a month or so, but when you get back, it'll be wonderful. And we're excited to see little Teddy. So for everyone that's listening, Lacey's having a little girl. She has a boy and a girl, right?
Yeah.
She has a boy. Your girl's 11 and your son's 9?
No, opposite.
Opposite. Her son's 11 and her girl is 9, and she's going to have a little girl, Teddy, in like 2 months. So she's going to be gone for a month or so, and then she's going to come back. We're going to have to get little Teddy a little like Modern Endocrine cult shirt or something so that we can
gosh, yeah.
put it on her. Maybe we can get her a little shirt that says like making the perfect microbiome or something like that.
Yeah.
So we can start her microbiome, right when she's born. But so I appreciate you coming on and chatting with me. I just wanted everyone to kind of be able to get to know you. So I'm going to chat with you and Summer and Dustin and just more people in the office so patients start to learn the people that are in our office besides myself, because it takes lots of people like you to keep the clinic going. So I appreciate you.
Yay. Well, we appreciate you too.
All right. Well, thank you.
So this is Dustin. Dustin is one of the nurse practitioners that joined Modern Endocrine about 2 months ago now. And so I wanted you guys to get to know Dustin as well, a little bit about him, his backstory. So tell everyone, Dustin, I guess, well, what is your name and what do you do at Modern Endocrine?
Yeah, so my name is Dustin Pollard, and I work as a nurse practitioner at Modern Endocrine.
So where did you come from? How did you end up in Modern Endocrine?
Yeah, so let's see. I started my nurse practitioner career in 2021, so just right kind of after the cusp of COVID. I worked primarily in pediatrics. So I did a lot of pediatric primary care and urgent care. I was there for about 4 years before I joined Modern Endocrine. As a nurse, I worked primarily in the cardiothoracic intensive care unit, recovering open heart surgeries, all of that stuff. So I did that for about 5 years. So what led me to join Modern Endocrine is, I was actually a patient first. Started seeing you for a lot of gut related things. I had, some horrible acid reflux, doing the full 9 yards, taking the PPIs, the Pepcid, all of that stuff, right? I had previously seen a gastroenterologist in Oklahoma City. I did a scope and they were like, yeah, you have an inflamed esophagus. And I was like, thank you. I know that. At the time, they did a biopsy and they were like, no, you don't have H. pylori or anything crazy in there. Just take omeprazole, 20 milligrams. You can go to 40 milligrams just for the rest of your life, basically. And then, I came to see you and you were like, okay, we need to do a GI map. And I was like, yeah. Of course, right? I did the GI map. I did, in fact, have H. pylori. Pretty significant bacterial overgrowths, right? I had leaky gut, all of that stuff too. I was treated with the protocol that you recommended, right? So I followed that pretty good and led to symptom resolution. In between, I had follow-ups with you and we would just chat about work, right? I was a nurse practitioner in pediatrics at the time, and we would kind of express our frustrations with, traditional medicine and how things were going, right? I was telling you about, some kids that I've seen with crazy high insulins, and it's just insane the amount of chronic conditions that kids have now, like food allergies, eczema, all of the things, right? And so I just voiced, frustrations along those lines. And then a few weeks after, one of our appointments, you called me up on the phone and was like, "Hey, how would you feel about joining my team?" And I was like, "I'm all for it. Sign me up." Yeah. And so that's kind of my story and how I got started here.
So 3 points. Number one, he, if you're listening to this, was a practicing nurse practitioner and went through our gut protocol. And like he said, he did it correctly. So I have a lot of people who are like, how can anyone do a gut protocol? Man. You can. I've done it. He's done it. Like, you just have to put your mind to it and do it. Like, it's not fun. It's like a sprint for 90 days, but you can do it. So that's my first point. My second point is we have to give a little bit of props to your mom, because your mom has been my patient for a really long time. And
1,000%, all the props.
He probably is the one who convinced you to come see me and then was like, you need to do this, right?
Yes.
So you got to give props to your mom, Lori. So she's like the sweetest person in the world. And that's why I knew you would be a great fit for Modern Endocrine, because if you're a product of your mother and your father, you can't be a bad person. So that's another point. And then thirdly, it's kind of funny. Summer and I were talking about this, like, we were like, well, we need another nurse practitioner, but we can't have one that sucks. And we need one that like definitely understands functional medicine or wants to understand functional medicine. But then also you have to be able to get along with us. And we're easy to get along with. We're just kind of like funny and quirky. And we're not like, how some people are very like in a box. We're not like that. And so also we wanted somebody who wasn't like going to make us feel weird. Like we had to walk on eggshells. Right. So we were like, and then Summer actually went to school with you and she's like, oh, I remember she was like, Cassie, Dustin's like super smart. Like he's like weird smart, like really, really smart. So then I was like, dang, is he going to be weird?
And you're like, yes, he is weird.
No, he's not weird. He's cool. At first, I was like, is he going to be as fun as Summer and I? But then after like 4 weeks, you finally opened up and you're actually really,
it takes me a little bit. Yeah.
If any of you have the privilege of seeing Dustin as a patient, he's actually hilarious. Like, he's actually really funny. And he'll just like throw something at you and keep a completely straight face and keep walking. And you're like, wait a minute. Yeah. That was actually
you gotta keep everyone on their toes, right? It's too easy if not, right?
So we've loved having him at Modern Endocrine. He's only been with us for 2 months now, but he's caught on very quickly. Summer's right. He's extremely smart and he has this background of peds. So we're thinking about incorporating some older children into our practice with gut health issues, things like that, because that's kind of his love. So he kind of ended up with us just in a weird about way, but we're happy that he's with us. So tell me, okay, so how would you describe Modern Endocrine to someone you just met? If somebody's like, hey, where do you work? What is that? What would you say?
Yeah, I actually love this question because I find myself saying this a lot when I tell people where I work. I'm like, think of like endocrinology, but like with a twist of like, to dig deeper, to find, I say like, I like to ask why, like that's our whole thing. Like we want to know why you're feeling this way and why your like symptoms are this way, why your labs look like that, right? And so, that's kind of how I describe it. I mean, it really is like a functional endocrinology practice, and you don't hear like any of that anywhere else, honestly. Yeah, you really don't.
No, you don't. And maybe I should use that for my commercial we're going to film. It's endocrinology with a twist.
With a twist. We'll work out the semantics.
I like it. Endocrinology with a twist. Maybe that can be our next t-shirt design.
Okay. I mean, that would be good.
I like it. Endocrinology with a twist. Okay, so that's good. I would agree with that. It's like we want to know why. And I don't know that the gut per se is like this endocrinology study. Like obviously there are GI doctors, but I feel like everything that nobody understands in medicine gets thrown into the endocrinology bucket. So I guess why not the gut too, right? Because nobody really understands that, but it's coming, people. If you're listening to this podcast, you mark my word, it's 2025. In 2030, if your doctor doesn't talk to you about your gut, everyone's going to be like, they're an idiot and you're going to go somewhere else. Because by 2030, there's a few of us that are on a mission to make sure everyone understands how your gut is related to your health, and you will want to know this stuff. So it's pretty cool. Okay, what do you love most about your job?
I like digging deep. I like looking at all the details of everyone's labs. If there's something that I've noticed from what I've just heard, just from the patients that I've already seen, everyone expresses the same frustration of, well, I went so and so and everything was normal, but I don't feel normal, right? And I'm like, well, when I look at your labs, like our approach to labs is a little bit different than, say, a traditional, provider, right? I explain it like you have your normal lab ranges, right? So you have like low range, high range, right? If your low range was a D plus and your high range was an A plus, right? You wouldn't want your kid to like make a D plus and be like, okay, yeah. So there's a lot more. So that's my favorite part is just like digging deep, understanding why, and really trying to optimize people's health and like have them feel the best that they can.
I love that. Yeah, I do that a
Yeah.
lot of that too. I'm like, yeah, your thyroid's working at like a C minus, D plus. So
Right. Which isn't going to cut it for a majority of people.
I mean, yeah, I guess it's
I
working.
hope not.
You're not dead, but you feel like you're
Right.
dead. So you want your doctor to get through med school with a D plus, C minus? Because I don't.
Right. Yeah. Yeah.
Yeah, I like that. Okay. What have you learned by working at Modern Endocrine? I bet a lot so far, but what are some things that stick
Oh my
out
goodness.
besides the fact that little baby Jesuses make everything better?
I mean, yeah, yeah. Sometimes works a little bit better than others, right? But no, what I've learned most, I mean, I feel like I was telling this to my wife the other day. I was like, I feel like I'm in like this hormone boot camp, right? And so doing all of this stuff, going to all the trainings, learning about pellets and optimizing hormones and everything too. And now we're kind of shifting to like more gut health kind of stuff now that I have like a good grasp on hormones, right? And so I love that aspect because we really like treat everyone as a whole body system as opposed to an organ system, right? And that's what's lacking, like in just traditional medicine. Everything is put into a box, and I know you preach on this a lot, right? But we're not just a big box with a bunch of little boxes. Like we're one big box that we need to be treated as such, right? So everything truly does work together, and that's what's been the most rewarding to me, but also the most interesting is to kind of learn about that and how everything interacts. Because yeah, we do kind of interact that way. So
It's true. Well, good. I'm glad. I'm glad that you like that and that you're learning. And that's kind of how we do it. I told you when you started, you're going to learn a lot. It's going to feel like you're drinking from a fire hose for about 6 months. And then you're really not going to be super comfortable for about a year. But you learn, like we teach you all these things, and it's amazing. And you have learned really quickly. And you just see, though, how it's so important to learn hormones and gut and thyroid. Like you have to learn it all, right? So it's very powerful and lifestyle. And I think it's really cool that you were a patient too. That's what I was telling Sarah, our health coach. Like you kind of already did it. So I like the fact that like if y'all see Dustin and you try to give him some excuses about your gut health issues, you're probably not going to fly very far. He's going to be a good accountability partner because he did it. And he didn't love it the whole time either. He can tell you he did, but he didn't. I remember. But he did it and he got better. So, he would be a good accountability partner. Okay. What is one interesting thing about yourself?
So other than like the normal boring stuff, like I have a wife and 2 kids, right? So I feel like that's just like, yeah, whatever. What you might not know is that in 7th grade, I spent a majority of the year in a wheelchair.
Oh, I didn't know
Yeah.
that. Your mom
Yeah.
never told me this.
Yeah. So I had a pretty good knee injury. I ended up having to have a procedure. I think it was called like a mosaic plasty, where they took some bone from my femur and like reconstructed some like bone that was just degrading from like blown out cartilage, essentially. And it happened because I grew too fast. And so just playing basketball, all of that stuff. And I remember, the surgeon, he was like, yeah, I've done this about maybe like 5 times. I was like a 12-year-old. You're like, what? But yeah, so that's kind of something, I guess, interesting, that not a lot of people know unless you went to middle school with me. But
How tall are you?
I'm 6'4" and 6'5" on a good day, is what I say.
He's pretty tall, you guys. I did notice that. He kind of he's very tall. Okay, well, that's interesting. I didn't know that. Your mom never mentioned that to me either, so shame on her. If you weren't working at Modern Endocrine or in the field of medicine, what would your dream job be?
This question's hard because I feel like it changes like every couple months, right? You're like, I think that would be pretty cool to do. Lately, like meteorology I think would be cool.
We live in Oklahoma. That's a terrible. You're going to be
Well,
wrong.
that's why I think it would be cool, because like our weather sucks all the time, right? We have like all this severe weather. But no, yeah, I would say that. I think that that's super interesting.
What was
Yeah.
it 3 months ago?
Jeez, I don't know. I
Okay.
really don't know. Yeah.
Okay. We'll ask you again next year.
Yeah.
Move
I don't
on.
know. I feel like I get in these moods and I'm like, yeah, I could do that. That would be cool, right? And then you're just, it's like a fleeting thought, and then you're just like,
No, that's a
just
bad
go.
idea.
Yeah.
I think you should stick to medicine.
Yeah, I
Okay.
think so too. Yeah. Okay.
One fun fact about you that people might find surprising, other than you're 6'4" and you're really funny. What else? It's fun.
Other fun fact.
I can't think if I know anything. I can't think of anything.
I went to Africa in a nursing school to work with kids. Yeah, in the jungle. So that was cool.
That's
It's a
cool.
fun fact.
I like
Yeah.
that. I
Yeah.
like that.
I did a lot of that.
What is one word that describes yourself? If you had to pick one word,
Ooh, one word.
one descriptive word.
Driven,
That.
I think, is a good one.
Yeah.
We'll also accept goofy. Second place.
Funny, driven, goofy.
Yeah.
I like it. Okay.
Yeah.
All great attributes.
Yeah.
What is your go-to healthy meal?
Okay, so lately it's been like just ground beef, sweet potatoes, some black beans, and avocado. Chef's kiss.
Yes, I can relate. Like he eats that for lunch and it looks so good. So
It is.
ground beef, sweet potatoes, black beans, and avocado.
Yes.
It does look really good too. Like some days I'm like, maybe I should still that before he comes.
And it's easy to meal prep too, so no excuses.
And you get fiber. Sarah would be so proud of you, our health coach. You're getting your fats, you're getting your fiber, you're getting your protein. She would be
You got to get all the good macros and the fiber.
Is there anything else you can think of that you would like to share with people? Like, what are you looking forward to seeing, or like, who are you looking forward to helping at Modern Endocrine? Is there like something in particular you really like doing?
Honestly, since I started, I have loved every aspect of it. So it's hard for me to pick one thing that I'm super like into, right? Because I want to learn it all. Like I want to be like a jack of all trades in this space, right? I will say I'm very excited to start seeing like some adolescents. I think like I'm very excited to see what their guts look like specifically, right? Because I'm like, are all of these kids, do we need all these stimulants? Like, I think that's the most overprescribed medication ever, especially with kids. And I'm like, do we need that? Like, I want to dig deeper. Like, is something going on, right? That like, so I'm super curious. And again, there's not like one aspect that I'm just like gung ho on because I want to like learn it all, if that makes sense.
Yeah.
Yeah.
I completely agree. And even with adults, there's a lot of adults out there on stimulants. And it's like, I look at those people and I'm just like, this is really sad. Your body is so confused. Like you're tired. You don't have the nutrients you need. Your gut's out of whack and you're just like hitting the gas. And there's no gas and there's no oil and there's nothing in your car. We need to hit the brake and figure out what the hell is going on under the hood.
Right. Yes.
So yeah, I completely agree.
Yeah.
Okay. Well, let's do some rapid fire questions. How about that? Because that's
Ooh,
fun.
okay. All right.
You
Yeah.
just pick one. Salty or sweet?
Salty.
Early bird or night owl?
Early bird, but brunch.
Summer or winter?
Winter.
Really? Ugh.
Yeah.
Okay. Rain or shine?
Shine.
Walk or run?
Walk.
Walk or bike?
Bike.
Ugh. Okay. Ocean or mountains?
Mountains, with a caveat being close to the ocean. I know that's a cop out.
Oh my God. Okay. Well, actually, I have one other question I want to ask you too, though, in all seriousness. Can you think of some tips that you would give someone who was going through our gut health program? Like, was there something in particular you found that helped you more doing the gut health stuff?
Yeah.
Or just any advice you would give someone?
Yeah, for sure. One thing that I think that helped the most with me There's a couple things actually. One thing would be ozone therapy. I think that that was like a complete game changer. Like I had so many overgrowths. And I was just so gung ho. I was just like, I want to do all of the things and I want to do it all right now. Right. Ozone therapy was a game changer. Right. I really think that that like helped with a lot of the die-off symptoms, right? But to be honest with you, because I did 6 weeks of ozone, so like one low dose and then 5 high dose treatments. I honestly didn't feel like I had a whole lot of die-off symptoms, and I think it was mostly due to the ozone. I really do. Other tidbits in regards to like food intake, fiber. I mean, that was a big thing for me too, and just knowing that there's like a light at the end of the tunnel, right? And it truly is like a marathon, not a sprint. Like this isn't something that you're gonna do that's like a quick fix, right? Because nothing that we do here is like a quick fix, right? Because we have to fix everything, right? And so just taking some time and just realizing, hey, this is a process. It'll get better. You're going to have slip ups during the program because we all do. Like, I don't know how many times I forgot to take a digestive enzyme, before a meal, but like that's the easiest thing to forget, right? So it's going to happen, but just get back on the horse, right? And so, but yeah. And then I was pleasantly surprised with my retest when all of my overgrowths were gone, my H. pylori was gone, my leaky gut was better, all the things. So just trust the process would be my biggest advice, and maybe do some ozone.
I would completely agree. That's why I brought ozone on, because I 100% know it helps mitigate all the bad side effects and gets people through their gut protocol, and then allows us to actually heal their gut. In addition to that, you get some additional energy. And yeah, then it gets people like you, the type A's who need their scorecard to be perfect, happy at the end because all their stuff is there. It's kind of funny because whenever I do gut health programs with people, I can be like Sarah and I will message each other. I'm like, this one's going to have A+ on their GI map or they're going to be really mad. Like there are just certain people that it doesn't matter. Like I saw a lady yesterday and she feels amazing, but she still has a couple overgrowths, and she was like almost in tears because she just had a couple stupid things on a piece of paper, but she's like, I feel totally different. And I'm like, okay, well, like that is the win. Like we can continue working on those things, but the win is like your symptoms, So.
Right. And I mean, is there a such thing as like a perfect GI map? Like, no.
I have not seen one.
Like, no. So, I mean, you're going to have some of those overgrowth kind of stuff too, but like, yeah. That's just
But if we ever see one, I mean, I guess we could give a prize for that. If we ever see a perfect GI map,
like the biggest gold star ever,
we will let you know. Yeah. But yeah, maybe we should have next year we should have like a Yumi, Summer, Lacy should all see whose guts can be the best and like have a competition.
Ooh, yeah. Yeah. I think we're on to something. Yeah.
Yeah. Well, I'll be in the red light bed every day, and I'll be in the ozone every week.
Unfair advantage.
I'm older than all you guys, okay? This is not fair either. Let me tell y'all. I love all my people. I'm older than them, though. I'm like, get back to me in 5 years. So I want to end by sharing two things with you. So I want to tell you the most common compliment I hear about you from patients, and something I personally appreciate about you. Okay. So the most common compliment I've heard about you from patients is that you are very like empathetic, kind, listen. They just feel like you are paying attention and actually want to help them. So that's a good compliment, right? Like, oh, he seemed very engaged in my care and he actually wants to help find an answer like you. So I appreciate that. Also, you just seem very engaged. So those are the things that patients have told me about you. And so that's, obviously if you want an engaged caring provider, that's important. And so Dustin is. I think that something I personally appreciate about you the most, it's hard because there's a couple things. I do love that you're funny because I like to laugh. And I love that you just randomly throw things in there too. Like today when you came out and threw that baby Jesus down, I was like, oh, okay. So I like that it's like randomly funny, but I think the thing that I appreciate even more so than that is just like I do see in you that you're very driven and empathetic and like you want to help people, and so you take it upon yourself to like learn. I don't necessarily have to hold your hand for everything. You take it upon yourself to go figure stuff out, but ask me when you need to. And I think that's just really important in life with like learning, especially in medicine, right? Like if you have the drive or desire to do something and help someone, then you just go do it, and you don't need me to necessarily point you in every single step of the way. So I think that I appreciate that about you the most.
Well, thank you. Yeah, those were really kind words. Thank you. I appreciate it. And I'm happy to be here and to see patients because I really do care and I want everyone to feel better. So
I know you do, which is amazing.
Yeah.
So, all right. Well, thank you for answering these questions and letting people get to know you.
Yeah. Thanks for having me.
We'll have you back. Again, I hope you guys enjoyed these 2 interviews. I'm going to try to do some stuff like this and not have as many guest interviewees, just so you know what it's like to really be a part of Modern Endocrine, a part of our team, and why we do what we do. So if you enjoyed this, I would like to know so I can do more stuff like this. Let me know by leaving a review wherever you get your podcast. You can let me know on social media as well. Make sure you're following us. I give out so much good advice and just education and information on social media at Modern Endocrine _. Also, our Gut Health Live webinar is going monthly and is doing phenomenal. So if you want to learn more about your gut, make sure you get on our wait list and sign up to hear one of those. Our licenses are now available in 42 states. So if you want to become a patient, we would be more than happy to see you. And finally, please, please, please leave us a review and share this because this is how we get the word out there. Have a wonderful week. I'll see you next week.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.